sometimes they multiply to a point when it adds to other things. What is breast cancer? Next slide. Breast cancer is a malignant tumor developed from the cells in the breast. It is the second most common cancer seen in females and the second leading cause of death in women. And I don't know, something is happening, I don't know for St. Lucia, but in Dominica, so many times when I see someone my age group or younger than me, and I ask, what did the person die? Breast cancer. Breast cancer. It has just become so common now. I don't know for St. Lucia, you all can tell me, but I think it's a worldwide thing. So many people are coming down, so many women, this cancer is taken away. Next slide. Breast cancer is cancer that can develop from the milk-producing glands in your breast, from the ducts or passages that drain milk, from the tubules. You know we have tubules and little ducts in our breasts, right? And those of us who nurse children know that. Breastfed. That kind of cancer can spread to the lymph nodes under your arm. And then when it spreads to the lymph nodes, then it spreads to the rest of your body. Okay? And that's what happens in breast cancer. So it develops. We'll learn also there are other types of cancer, but most times it develops in the milk-producing glands, in the ducts, in the passages, as you can see in the picture, right? And then it spreads to the underarm. It can. In my case, and I'm going to be, because I was diagnosed with breast cancer, I'm going to use myself as an example. Thank God. When I was diagnosed with it and when they did test, it had no time to spread to my lymph nodes. So none of the lymph nodes in my arm, under my arm, we say metastasized. Okay, the cancer had not spread to any of my lymph nodes. That was the best news I could have gotten. But for a lot of people, the cancer spreads to your lymph nodes. Sometimes one, sometimes two lymph nodes, sometimes three, and it's based on that, the stage you, as to whether you're 0, stage yours, they call cancer inside 2, just beginning to show itself, stage 1, stage 2, and even stage 1, there's luminal A, there's luminal B. I'm not going to go through all that, but stage 1, stage 2, stage 3, and so on. And the higher the stage is the poorer the prognosis, okay? But there are a lot of people who have been diagnosed with a stage 3 or stage 4 and they're still going very well. I have this friend who died recently. She died, but she died in her age of 80, in her 80s. And when she was diagnosed with breast cancer, she was given a stage 4 and she was told she had 6 months to live, but she lived 30 years. So, you know, miracles do happen. Who is affected? Next. Who is affected with cancer? 1 in 10 women will be diagnosed with breast cancer in their lifetime. Although breast cancer is rare in men, and that's why I'm glad we have some men there, some men have been diagnosed with breast cancer. I remembered as a student nurse, when the surgeon, one of the professors came and he presented on breast cancer, he said, 1 in 10 of you will end up with breast cancer. I happen to be one of them. I didn't know it was going to be me. I'm sitting there like an innocent little 20 coming into, and I say, who, me? Me, not me. But I ended up being one. He did say 1 in 10, and it has been like that. 1 in 10 women will develop breast cancer. What are the risks of developing breast cancer? Next slide. I hope you all can read that. Yes? There's what you call the uncontrollable ones. You understand what I mean by uncontrollable? You cannot control it, it just comes. A positive family history of breast cancer. In other words, one or more relatives with breast or even ovarian cancer, they're predisposed to developing breast cancer. I have this friend in the United Kingdom. She came 5 girls, 5 sisters. 3 of them have already been diagnosed with breast cancer. 1 have died. And when she went for a mammogram, they saw early signs. So she immediately asked them to, it was not, they just saw the changes that were occurring in her breast. And she didn't waste time. She asked them to remove the breast because she knows of the strong family history. So 1 or more relatives with breast cancer predisposes you to it. Your genetic predisposition, early menarche, you all understand what I mean by that? If you had your period came at the age of 9 or 10. No, I'm not saying, let me tell you, those are just things, that doesn't mean you will get it, Get that off your mind early. But they're seeing that if you started your first menstrual period 9, 10-year-old, that puts you at risk of developing breast cancer. Late menopause. If you went into menopause, and you know when we pause, right? When our flowers all dropped and we pause. When you go into late menopause, like you went into menopause 60 and so on, very late, most people by 35, 40, 47, 48, 49, 50, 51, you should go into that. But some people may go a little late. That predisposes you. And exposure to radiation. So for instance, we have a member of our church, the Berean Bible Church in Rosal, wonderful lady. We were very close. She died of breast cancer. But her breast cancer came, she was a radiologist. She did a lot of x-rays. And the exposure to the radiation, the constant exposure. And guess what I said there? The frequent, constant, high exposure, because she was doing a lot of x-rays. That's how she got her breast cancer. And she eventually died from it. Then next slide, we have the controllable ones. No, that's not it. The other one. Oh, it's on the other side, I forgot. We have the controllable ones, the ones that you can try your best to take care of yourself and could limit your risk of getting it. Obesity, big people, older age of first live birth. You understand what I mean by that? Okay. So, if you were born, if you were like you were in your late 40s or so, and you had your first child, if you got your first child late, you conceive late, that puts you at risk of getting breast cancer. If you have never had children, that puts you, let me tell you, I myself, I was preparing that thing, and I'm going through my studies, and I'm reading them, and I'm saying, some people who have never had children, they have lived all their lives, never got breast cancer. But they say that's one of their risks. Never having children puts you at risk. Now, when I say that, that doesn't mean you will get it, okay? They're just research, studies. Alcohol consumption. I'm going to add one. Fibrocystic, it is not there, and I'm adding it because that's what I had. Fibrocystic breast disease. Now, that's cystic, benign, non-malignant cyst that just in the breast due to hormones occurring in your body. When I had my son, when I had him 6 weeks later, I saw 2, 3 lumps appeared in my breast. Now, as a nurse, when you nurse and you know things, everything frightening you. So when I saw that, I went to my doctor, and he said we are going to do cut off one to test. But he's saying, that is not a cancerous thing, but I want to know. So we went into theater, and when he cut it off, while he was cutting, it burst, the cyst burst. And he said, Ms. Fontaine, you see, I told you it was nothing. Look, the cyst burst. After that, I began to just have Cysts. Always had cysts. Multiple of them. They call my breast a lumpy breast. And fibrocystic breast a cyst can lead you to having breast cancer. So when I went into menopause, and they always told me when you go into menopause, and just to add, for 12 years, I had needle aspirations every time, removing those excess fluid. And once I see it come out green and yellow and nice, I say, oh, that's cystic, I'm not bothered, you know? And I did that for 12 years and did less mammograms, because once I saw some strange big lump that I was concerned about, I would just go to the surgeon and say, so when I write in the hospital, I'm telling them, just put a needle in that and aspirate that for me. I just want to make sure that thing is okay. And once I see yellow fluid, I say, oh, it's just a cyst. So I was not doing mammograms as often, and I blame myself, because maybe I would have identified that this one, however, I was going to say something, and a senior moment just came here, and I just forgot for a little while what I was going to say. But however, when I went into menopause, all the lumps disappeared. I was not feeling lumps again, and I'm sorry, but this one remained in this breast, in the left breast. And it was very mobile. And I want to say that I've changed my belief about lumps. I was taught as a nurse educator when I went to study that mobile lumps, you know what I mean mobile? When you touch the lump and it's moving in, and I used to play with the lumps, you know. They were just moving like balls in the breast, and I used to just play with them. Yes, I bought my bed and I played piano with them and with all things, you know. They are mobile because they are non-cancerous, and multiple lumps are good lumps. That's what I was taught. I was taught it's just one lump, but they told me it has to be fixed, not mobile. So when all these other lumps disappeared, but this one stayed there and it was nice and mobile, I say, that's just a cyst. I ignored it. But this was the lump that, even when, it's a long story if I have to give how I ended up knowing I had breast cancer. That's not what I was asked to come and talk about tonight, so I'll not say much. But when I saw some blood come out from my nipple after an accident in the U.S., just to make a long story short, when the doctor touched the lump, he said to me, even in the States, in the U.S., when they felt that lump, they told me, that's just a cyst because it's so mobile. And then when I got to Dominica, I did mammogram, suspicious lump, ultrasound, suspicious lump. Then I had to do a biopsy. And even when I went to do the biopsy, the doctor says, oh, Nurse Fontaine, that's so mobile. That's not a breast cancer lump. That's not a cancerous lump. I hope they changed your thought. No, because it was a cancerous lump. When it was excised and tested, it was cancerous. So I've changed my thing, Papa. I don't tell anybody. Since you have a lump, go test it, all right? Don't joke. Don't do like me and play with lumps. Go test it, okay? So, yes. So I wanted to bring that in, that fibrocystic breast disease also exposes you to getting breast cancer. Screening, next slide. So for screening, we encourage women to do, is that on there? We encourage women to do breast self-examination. And also do, if you don't do a breast self-examination or you're afraid, you can do a clinical breast examination, meaning you can go to the health center and have the nurse examine it for you. We encourage women to do a mammogram, and I will talk about how often you do it. Next slide. We encourage women to do a mammogram. Even with the lowered rates of breast cancer, and it's still lower compared to before, because they have done so many studies now that people can do things to prevent themselves from getting breast cancer. Somebody just introduced me to a brassiere. They say, Papa, if you put that brassiere, you might not get breast cancer. So you see, they have all kinds of things now. She's advertising it. At the end, you can ask me, I'll send you to her. Even with lowered rates of breast cancer, always stay aware of your body. A breast self-examination is a checkup a woman does at home. That's yourself. You'll the first time, the best time to do a breast self-examination is for those who are still having periods, is about 3 to 5 days after your period starts. You heard that? 3 to 5 days after. In other words, if you try to do it before your period, during the time when you're getting ready for a period, your breasts are tender. You right? Your breasts, you feel tender, and there might be lumps in there, and there may not be anything. It's just as a result of the surge of hormones and what's happening that's causing you to feel those things. So the best time is 3 to 5 days after your period starts. Your breasts are not as tender, as I just said, or lumpy that time of your cycle. If you have gone through menopause, you should do it the same day every month. So for instance, today is the 8th, right? So you decide tonight when you go home, you're going to do, after we show the little thing what you do. So you decide you're going to do it tonight. You put that date. The 8th of next month, you do it again. Okay? That's for those of us who have gone through menopause. What to look for? Next slide. When you do a breast examination, you feel for a painless lump in the breast or in the armpit. Now, I've had people who have diagnosed with breast cancer, and she told me it was just, she just felt a lump under her arm. There was no lump in the breast, you know. It was just in her armpit. And it went and tested, and she was diagnosed with breast cancer. Okay? So, and usually, the lump is painless. And I'm telling you that because if you feel a painful lump in your breast tonight, don't go, I have breast cancer. All right? I'll tell you that there's a member from my church. She's very amusing. She's not in Dominica anymore. One day she got up and she felt a very painful lump in her breast. And she went to the doctor crying, trembling. I have breast cancer, a painful lump in the breast. The doctor said, relax. Breast cancer never starts with painful lumps. I want you all to get that. When the lump becomes painful, it's at its final stage, when nothing can be done again, okay? Breast cancer. So the one I had mobile in my breast was never painful until that night in New York when I had an accident, and shoop, I felt this pain, and I thought it was the accident that caused it. But lo and behold, it was God allowing this accident so I could identify that I had breast cancer. Look for changes in breast size. So I have a picture there that is, can you see a lump in that breast? You identify a lump there, right? Can you see a lump? There's a lump right just above the nipple, okay? You can see it. And then you look for changes in your breast. What type of changes? Next slide. What type of changes? I've shown some pictures. Nipple retraction. Now, some of you have normal nipple retraction, so that doesn't mean you have breast cancer. But if your nipple was not retracted before, so you had a nice pointing nipple, but all of a sudden it just went in like that, like what you see in those pictures, in this picture, that should be of concern to you, okay? Little blood coming from your nipple. So for me, I had this accident right on the street highway in New York, and I went home. I was shaken. Nothing happened to me. My daughter wanted to take me to the hospital. I said, I feel fine, nothing. The next day, about 5 p.m., I felt this sharp pain right where I had the cyst. And I said to my daughter, I've never felt the cyst so painful. So I said, as soon as I go back to Dominica, I'm going straight to my doctor. 30 minutes later, I had just a little thing of blood just came out from my nipple. Of course, it frightened me. But in my mind, I was saying maybe some ruptured vessel from the accident. That's what I thought. And then I went through mammogram and everything, and it turned out that it was a cancerous lump. So look for changes, look for nipple retraction, look for discharge, Look for changes in the skin texture, such as dimpling. You know what a dimple is, right? Some of you have dimples when you smile. Yeah? Right. So if you see that occurring, a dimple on your breast that you did not notice before, you need to go and check it. It may not be anything, but just to be safe, okay? Look for puckering on the skin that looks like orange skin color. So, you know what an orange skin look like, right? If you see your breast looking like that, all of a sudden it change orange looking color, and you're seeing little pimples and it look like a grapefruit skin or orange skin, don't rush to the hospital or rush to a doctor. Go and check it. Y'all face looking like y'all are frightened, man. Am I frightening you? No, that doesn't mean it's going to happen, but these things you need to know. Breast pain may also be a symptom as well. But as I told you, I got this sharp pain, and it alerted me because I'd never felt my cyst that painful. I hardly felt any pain. So when I felt this sharp pain, I said to my daughter, no, I'm going, when I go to Dominica, but the Lord says, no, you're not going to wait to go to Dominica. I'm going before you. So I'm going to let you test it now, okay? And he allowed me to see. And by the way, this little blood came out from my nipple, and I never saw it again. I went to the hospital, and they squeezed, and they did their mammogram. They crushed the breast. They put all things there to see blood. No blood. But blood came out, a little drop. That was just God alerting me. Next. Okay, so let's learn how you self-examine yourself. Examine your breast in a mirror, and I have some pictures there, with your arms down, up, and on your hips. Can you see that? Next. Examine your breast in the shower. I know of a nurse who ended up knowing she had breast cancer. She was just taking a shower, and the soap on her breast, and she just felt, for some reason, while you're not hearing me when I move across there? Okay. For some reason, when you're in the shower and the soap is gliding over your breast or the water, you may feel a lump. You may. So you can glide your hands, examine your breast in the shower, place your left hand behind your head with the fingers in your right hand, gentle yet firmly, press down using small circular motions to examine the entire breast. Small circular motion. And you just do that. And if you feel a lump, you may feel a lump. Now, mark you, sometimes there are lumps that are not palpable. Because a few months ago, when I went to do my and by the way, I'm due for a mammogram this coming Saturday. And a few months ago, just before a women's conference, they saw a little lump, but I'm squeezing, I'm not feeling anything, but the mammogram and the ultrasound was seeing something. It ended up not being anything, but sometimes there are lumps, and this is why we come into mammograms that are so important. Next slide. You need to also feel your armpit, also palpate in lying down position. I have this position there that you can see. Gently squeeze. So after you have palpated in circular motion, then you come, then when you reach to your nipple, you gently pull out. You just pull the nipple to see if there's anything coming out from it. Okay? It might be bloody, it might be milky, it might be white, it might be yellow, okay? But to see if there's any discharge. So always remember that. When you finish examining, you pull on the nipple just to make sure. And you pull, not just you pull from the areola, the black part around, or the cream part, or whatever color you have, okay? Because there are all different colors of people inside there, okay? Whatever color the breast look like, the part of the areola, okay? You pull from there and so on. And you repeat the process on both breasts, okay? And how often do I say you do that? For those of you having periods, when should you do that type of examination? Right, when your period is on its way. And for those of us who have gone through menopause, don't forget that. Thank you. Okay, next slide. Rare signs to be aware of. There's a sign. We just lost a person from our church who had this type of cancer. That is the inflammatory type of cancer. That's the bad breast cancer. But of course, we still have some people who have survived it. It's called inflammatory breast cancer. And this lady saw this little pimple on her breast. She went to the health center, and the doctor gave her some cream to pass over. He failed to ask her to do a mammogram, an ultrasound. He did not do those things. And she went home, and she continued to apply the cream. But the pimples kept spreading. And it had to take, we have a family nurse practitioner in our church, and she just asked her to look at the breast. And when the family nurse practitioner, and if she had asked me to look, I would say the same thing, immediately go and check it. When they checked it, she was already stage 4. But it started, so if you see, mark you. Not any pimple you see on her breast will be breast. I have to say that because I don't want you to think, you see a pimple, let me run. But I'm just saying, if you see something strange on your breast, a little pimple, because I just said you may not have a lump inside. It may start with that type of breast cancer. And this is the very progressive type of breast cancer. A lot of times when people get this type of breast cancer, the prognosis is not good. I was diagnosed with ductal carcinoma of the breast. In other words, it was in my ducts. And a lot of times when it's like this, if it's caught early, your chances of survival, and that doesn't mean the cancer can come back, but the chances of you surviving and being cancer-free is better. But in the inflammatory one, it's the bad type of breast cancer. So if you see something like this on your breast, no, it could be a bee that sting you, yeah? So I don't want you, if you see that, to say, whoa, but don't take it. You know, a bee could sting you. By the way, before I was lying in bed, and I felt, ouch, on my breast. When I watched a bee, the bee went into my nightgown and stung my breast. And let me tell you, I scratched, and the thing was like this. But because I knew it was a bee, I don't know what was wrong with the bee. The bee felt it's right in my breast. It wants to come and sting. So a bee can sting you, a mosquito can sting you, things can sting. That doesn't mean you have breast cancer. You get what I'm saying? But if nothing stung you and you saw the sting appear, okay, don't take it. And let me repeat, I'm not here to scare you. I'm just telling you, all right? So inflammatory. It's the uncommon type of breast cancer where there is no distinct lump. Skin becomes thick, red, and look pitted, warm, or tender with rash that looks like that. In 2015, when I went to Texas for my daughter's graduation from university, just before I went, I had this lumpy breasts. They were so big, so I went to the surgeon and I told him I would like him to aspirate them before I go to the U.S. And he made me lie down, show all my breasts, and he had all his medical students, and they're talking about my breast. He didn't even ask me permission, but I'm okay. They're enjoying their studies of my breast. And then he started to prick, and he's there. He's pricking and pricking and pricking, and he's not getting any. And you know, I told you I always look for the yellow fluid. He there, Miss Fontaine, I'm pricking. Can you see? I said, come on, doc. Let me position the breast for you. So I there positioned him and eventually got, but because he had pricked so much, so many times, looking, my breast looked like that when I got to the U.S. It was very painful and like that. And I was a little scared because I thought maybe it was some inflammatory breast. But then it dawned on me, oh, this man pricked and traumatized my breast. So I medicated myself, and a few days, it was gone. When you're a nurse, you can do your own thing, you know? So I medicated myself. When to begin screening? When to begin? 20 to 40 years, between 20 and 40 years, you do it. And let me tell you, you might hear different things there. I got this from one of the recent research studies, but some other people may have different things. But and long ago, they would tell you when you're 20 years, you don't even study, you're very unlikely to get breast. But we have had 23-year-olds and 24-year-olds dying of breast cancer in Dominica. Yes. So now it's just a thing that's affecting. So 20 to 40 years, 3 yearly clinical breast examination. After 40 years, you do your annual clinical breast examination. But I'm just saying that could change because we have had people, 35-year-olds and whatever, that do breast every year. Annual mammogram, and I really want to encourage you, don't be like me. I stayed 12 years. When the doctors in the States asked me, when last you had a mammogram, I said, 12 years ago, we doc. 12 years ago. No, it was 8 years ago. And they asked me, why was I not doing a mammogram? And I told them, well, I was just going, since I'd done an ultrasound, and the doctor, a Cuban doctor, said, you're cysts all over. You're cysts all over. And I just felt, well, I have cysts all over. So all I did, once my cysts became symptomatic, when they were active, I just went and let them aspirate. But I blame myself. Maybe if I took this cyst more seriously, this mobile lump, I maybe would have not even had a mastectomy. So annual mammogram from the age of 35 years. You can do that. And women with 25% risk of breast cancer. So for instance, if you have the women with risk of breast cancer, all of the above, okay? All of the above I mentioned, they need to do mammograms. So like for instance, because I was diagnosed with breast cancer, my daughter is at risk, so she has to do a yearly mammogram. If you have a strong family history of breast cancer, sisters, siblings, we encourage you to do a yearly mammogram, okay? Now, here's some, turn to the next, a very interesting slide. Can you all see that? Can you all read this? Okay, but I'll read it out. There are some breast cancer myths. You know what a myth is, right? Things people say, and a lot of us take this in, but they are not true. They are just myths. One of them is only women can get breast cancer. Men can get it. I nursed a young man on the male surgical ward who had a lumpectomy, meaning his lump was removed and it was tested positive for breast cancer. It is very rare, but we have had 1 or 2 men ending up with breast cancer, okay? And here it is, for every 135 cases of breast cancer in women, 1 man is diagnosed. So I did come across 1 man. I see him all along in town when I walk. His sister is a nurse, and he was diagnosed with breast cancer. Small-breasted women have less chance of getting breather sigh of relief. No, but that's a myth, okay? Small-breasted women have less chance of getting breast cancer. That's a lie. No connection between the size of your breast and your risk of getting breast cancer. Small, medium, large, very large, you can get breast cancer. Breast cancer always comes in the form of a lump, and I told you also already, okay? A lump may indicate breast cancer, but women should be on the alert for other kinds of changes, as I just mentioned. And by the way, we'll come back. I'll talk about this. Only women with a family history of breast cancer are at risk. Nah. Roughly 70% of women diagnosed with breast cancer have no identifiable risk factors, you know. They tell you, and I did not even have this there, they used to tell me, and I tell my mothers, because I worked on the neonatal unit for almost 12 years, taking care of newborns, and I would tell the mommy, giving them a little breastfeed, exclusive breastfeeding for at least 2 years, you may not end up with breast cancer. I did exclusive breastfeeding, and I end up with breast cancer. So you get what I'm saying? So some of those things. Most breast lumps are cancerous. Big lie, all right? And I told you all I had multiple breast lumps. And by the way, multiple breast lumps in your breast are always good signs. Is that one that you have in there that may be cancerous? So if you have multiple breast lumps, it's very likely they're all very nice lumps. That doesn't mean you don't check them, eh? But most times, multiple breast lumps are indication of good breast lumps. But it says 80% of breast lumps are benign, non-cancerous. So if you have lumps in your breast, it's good to check them. Remember I said that? But that doesn't mean they may be cancerous, all right? Breast cancer is non-curable. That's a myth too. 90% of early stage breast cancers are curable, often with breast-conserving treatment. So when I was diagnosed, I was diagnosed as stage 1 luminal A. And stage 1 has a 99% curable rate. Now there's still that 1% that it could come back. So you see it? So I have a 99% curable rate. Other myths. Caffeine causes breast cancer. I used to believe that. They used to tell me, because you have all this cystic breast, stop drinking caffeine. But there is no connection. No connection has been found between drinking coffee, caffeine, and getting breast cancer. Annual mammograms, and I've heard that, I even thought so myself. Annual mammogram exposes you to so much radiation that they increase your risk of cancer. While it is true that radiation is used in mammogram, the amount you get is so small that any associated risks are so tiny when compared with huge preventive benefits. We lost our slides. Let me tell you as we continue, it's just myths. They said having a risk factor or even several mean you will definitely get the disease. No. Okay? So even if I told you your sister had it and you may get it, just know. That doesn't mean you will get it, right? I learned that, and I thought so, that only if your mother had breast cancer, that you are at risk of getting it. And if your father's sister, for instance, had breast cancer, you would not get it. But when I was diagnosed, I had an aunt who died. She died from breast cancer years ago. So remember, your father's family history of breast cancer doesn't affect your risk as much as your mother's. Your father's family history of breast cancer is just as important as your mother's. Wearing antiperspirant increases your risk of getting breast cancer. That too is just a myth. Because they have said to you the aluminum in there increases your risk of getting breast cancer. Since I was diagnosed with breast cancer, I myself, you know what I use? Baking soda I'm putting under my arm because I myself drank that thing well, aluminum. I still, but really, when you do a study, not many people, okay? So that's where I end on breast cancer. Remember the myths. Remember your breast self-examination. I was not there to scare you. I just wanted to tell you. Now, Sister Deborah asked me to do a little presentation on liver cancer. It is short. I am not a doctor. I didn't want to tell her that. I don't know why she thinks I'm a doctor. I'm not a doctor. I don't know much. But I was able to gather a little information about liver. I don't know why she specifically wanted to know about liver. She knows. But liver cancer. Your liver is, you can turn. Your liver is the largest organ in your body, helping you to digest your food. I know you might not be able to read that. So it's also one of the most important organs, as no one can live without their liver. We know that, right? Some of the essential tasks your liver does as follows. They collect and they filter your blood through your intestines. They store nutrients in your intestines. They change your nutrients into energy substance. I'm just giving all those things. They make biles. You all know bile, right? And fluid, and helps to digest fat. They digest and store the nutrients. They make substances that help you with blood clot and all those things. That's just for reading. We're not going to go into all that. I'll leave that for my nursing students to study. I'm not giving no exam after, right? What is liver cancer then? Liver cancer is a life-threatening illness and one of the fastest growing cancer types in the United States. But I took that from a United States site, so that's why it says United States. But it's also anywhere, okay? There are two kinds of liver cancer. The primary one that starts in the liver, and the secondary one that spreads to your liver from another part of your body. You get it? So there might be one that just starts in your liver, and then one started maybe by your pancreas or by your abdomen or by your stomach, and it spread. Liver cancer, next slide, is liver cancer a common disease? No, it is not common, but liver cancer cases are steadily increasing, and I've met one or two, and healthcare providers estimate about 1% of men and women, I said in the United States, will be diagnosed with a form of liver cancer during their lifetime. Very slow. It's not a very common cancer. I have not nursed many people with liver cancer, and I've been a nurse since 1988. What are the types of liver cancer? There's one called the hepatocellular cancer, and carcinoma is another word for cancer. This is the most common form of liver cancer, and it represents nearly most liver cancers cases. There's one that's called the intrahepatic cancer, and it's a cancer in your liver bile duct. And you all are familiar with bile, right? This greenish thing, yes? And it represents about 10% to 20% of all primary liver cancer cases. And there's one that's called the angiosarcoma. This type is very rare, representing about 1% of all primary liver cases, cancer. And this cancer begins in the lining of the blood cells in your liver, and then it affects the other organs. Who can be affected by liver? The ones we spoke about, hepatocellular and intracarcinoma, more men than women, yeah? And are most often diagnosed in the ages of 55 to 64. So it's more common in men. And people whose race, they said Asians, Hispanic, American, Indian, it's not so common in blacks, but we do get one or two. What are the symptoms of liver cancer? When liver cancer is at its early stage, you might have no symptoms. But then you may feel a lump in your rib cage, or pain in your right side of your abdomen, or pain near your right shoulder, and then you end up with jaundice. You get unexplained. Jaundice is the yellow thing of your eye, right? And yellow of your skin. Unexplained weight loss, vomiting, nausea, fatigue, dark-colored stools, and the dark color. All of us pass bile when that helps give our stool its color. But when you're passing, or so much is circulating in your blood and going through your kidney, your stool will appear darker than ever. And the early warning signs of liver, unfortunately, you can have very early liver cancer without any symptoms. And if you know you are at risk for liver cancer, you talk to one of your healthcare providers. They'll do some tests and they'll run something. And how is it diagnosed? By certain blood tests, and they do ultrasounds. They may do an MRI, they may do CT scan, and so on. They have to biopsy. I have a friend in the UK who they just did a biopsy of her liver for her, but it came back, thank God. They didn't find anything cancerous. How can I prevent liver cancer? While you can't completely prevent liver cancer, you can do the following. Avoid behaviors that lead to cirrhosis of the liver. You know what? Anybody heard of cirrhosis? Alcohol and so on. Reach or maintain a healthy weight. get a hepatitis vaccine test. The vaccine is safe for nearly everyone. Avoid the hepatitis C, that is the dangerous one. If you have any liver disease, if you have diabetes, obesity, or heavy drinker, you can ask your doctor to just check, do a liver screening to see, is liver cancer curable? The studies show that successful liver transplants can cure liver cancer, but not everyone who needs a liver transplant will be healthy enough to go through a transplant anyway, all right? Studies show that people who have surgery to remove part of their liver tend to live longer than people with whose illness prevents surgery. When that happens, healthcare providers like me and doctors, they focus on the treatment to help people live longer with the quality of life while they have liver. And that is what I know about liver cancer, okay? It is not common in Dominica. I'm sure it's not common but that's the little I could gather, because a presentation on liver cancer is so broad, right? But I just selected just that little bit. I really wanted to focus on breast cancer. Next slide. Thank you. Any questions? Don't ask me much about liver, okay? Ask me about the breast. Any questions? If no questions, we can end. What about the womb you want to find out? Well, the womb itself, just like you can get breast cancer, the womb can end up with not breast cancer. The womb can become cancerous. And this is why we encourage people to do pap smears, pap tests. The sexually active women that engage in a lot of sex and are married and women who are having children and so on, you must do your pap smear, and we encourage a yearly pap smear. Because what happens, if you end up with cancer of the cervix, that cancer can spread to your womb. But also you can get a cancer of the inner lining of your womb. When in 2011, and I like to talk about myself, but God has been good to me, eh? In 2011, I developed what you call a dysfunctional bleed. And if you have a bleed, if you're bleeding, you're having a period that is not under dysfunctional. Like for instance, you're supposed to get a period every 21 or every 28 days. And if you notice you got and then another one came, stress could cause that. And a number of things could cause it. But if you just started having a dysfunction, so I started to have a dysfunctional bleed. And I went to the doctor, and it just wasn't stopping. He gave me some medication. It stopped for a while. It came back. And then 3 months later, when I saw it just wasn't stopping, I went back to him, and he says, well, okay, let us do what you all call a dry operation. You all say that here? Huh? In Dominica, they say dry, then they scrape you. They go into theater, and they take you into theater, and they scrape out your womb. So he took me into theater, operating room, and he said he saw a little polyp in there, and he scraped it out. And we were waiting for the results. And when the results came, he says, you have something called complex hyperplasia. Don't bother about this term. But it means that the cells in there were beginning to change. And he said, you have a choice. Remove the womb or biopsy your inner lining of your womb every 6 months. Which one I chose? I removed the womb, and I've never missed womb up to today. I was so happy to remove womb. Up to today, I've never missed womb. You'll not miss it. Remove it. So I removed the womb because when I went and read, and I always say, thank God that I can read, and always read to find out for yourself. When I read, they said complex hyperplasia within 3 months could turn into endometrial cancer or cancer of the inner lining of my womb. So I went and I said, Doc, just remove that womb. I was 40-something years at the time. I have 2 children. He says, Nurse Fontaine, you can keep your womb. I said, Doc, remove the womb. He said, let me look at my schedule. Oh boy, I'm booked for surgery. Doc, call somebody. It was approaching Carnival. Call some lady. Maybe she wants to go and jump up. Tell her, give me a space. Lo and behold, she called the lady, say, Doc, I'm so happy. I want to go and do a little jump up, and that's how I got my space. I removed the womb. I have never missed womb up to today. I didn't joke. But I have another extreme, where another lady was diagnosed with the same thing like me, complex hyperplasia from dysfunctional uterine bleeding. And the doctor said to her, she decided she would wait. And within 3 months, 6 months, when I found out she had cancer of the womb. So I'm just saying, you know. So yes, you can get cancer of the womb. And there are different types of, the womb has different parts. So any of the parts, your ovary, and by the way, ovarian cancer is the deadly one, okay? If it is caught early, stage 1, but most times, okay? And it's just like breast cancer, it can be hereditary. So you can get cancer of the fallopian tube, of the ovaries, of the cervix, but cervical cancer is the more common one. So we encourage you to do your pap smear every year, okay? Any other question? For some reason, we all have, by the way, all of us have cancer cells there in our body. It is there. It is a normal cell per cell. But for some reason, these cancer cells begin to change, and they begin to attack tissues and organs, and they just begin to replicate. There are so many theories as to why that happened. Say it's because of genetics, certain things we eat. They said sugars tend to feed on cancer cells and cause them to go haywire, all kinds of things. But they still do so many studies. That's why they cannot even find the real cure to stop cancer, because they're still studying so many things. Recently, I was looking at BBC News, and they found a vaccine now that they're testing on people with cancer of the stomach. And there's this one guy who's doing that. He's doing a trial, and they're giving this vaccine that it appears to be, they said, it appears to be destroying the cancer cells. And the guy has been looking, because stomach cancer, usual prognosis is so good, so poor. But he's been doing well, and they're saying if it works, they want to see if they can get one for breast cancer. I would say hallelujah, I'll be the first one to go for it. But you know, yes. Any other question? Just a risk, yeah, at risk. If you have never had any children, that puts you at risk. They just say that. Doesn't mean you'll get it, but that's what. I don't know why. I can't answer. That was just one of the risk factors that I really don't know. There's so many risk factors that they still come. I did not even mention all. I just selected some, but that was one. Okay. Somebody's breast could have a discharge, for instance, if there's an infection in there, because you could end up with an abscess in your breast for some reason. If you're breastfeeding, you're going to have discharge, milk coming out, right? If there is a tumor of your sometimes there's the endocrine gland. If there is a suspected tumor there, you could have some milkish discharge. There's something called oxytocin. If you're producing more than normal, you could have some discharge. And mark you, while we look for discharge, not all discharge says that it will be cancerous, okay? And by the way, just recently, a little nurse came to me and she said to me, Ms. Fontaine, my sister, blood came out from her nipple. And she was so afraid. And you know, they did mammogram and there's no cancer in her breast. So not even, but most times if you see a bloody discharge, don't joke with it. But in her case, her own was bloody. I have seen discharge, yellowish, greenish, all types of discharges, and it may not be cancerous. But you may have some, so there could be many reasons why you could have a discharge in there. Hormonal and other reasons. But once you see a discharge, No matter if it is clear and you knew you're not breastfeeding, you're not, oh, by the way, I'm going to throw out something there. For the married, no children there, right? When you're in bed with your husband and he's sucking at your breast, you can get it can stimulate and you can have milk coming out from there too, yeah? It can cause things to come, you say, all right. So that could cause a little discharge. So those are other things that we get discharged for. You wanted to ask a question at the back? The lady in pink.
I was wondering about the link, if there is truly a link between estrogen levels and cancer, because they talk about things like, when you go past a certain age, and your estrogen levels stay too high. Like we have women in the blue zones, like Asia, Japan, that sort of thing, and their diet with soy, natural soy, they don't have that type of cancer over there. So I'm wondering, is it true?
Yes,
Do you know of any
yes. There is a link between estrogen levels and even with me being diagnosed breast cancer, most of us, they do this special test to check our estrogen level to determine the prognosis and also to determine how you respond, because yes, estrogen has to do, your estrogen levels plays a lot at putting you at risk for breast cancer, and that's just why women are at risk, because of the estrogen. And Sister Deb, it would have been nice if one day I can come back and do something on prostate cancer, because remember, that's another common cancer, yeah, in men, prostate. But yes, you're right, the estrogen, because even when I was diagnosed, there's a medication I take, and I had to test the positive reaction to the estrogen levels in my body. And it gave me a 99% point positivity, showing that I do have a level of estrogen in my blood, that the medication, that would respond well to medication, or something like that, I remember. Yes, but estrogen, that hormone plays an important role in...
So would you agree then that perhaps diet would, because you know there are foods that sort of help balance out your estrogen levels. So do you know if it's true that diet can contribute to a better or lowering your risk of breast cancer?
Well, for me, I have changed my diet. And we are encouraged to go on more plant-based diets to avoid cow's milk. I have stopped all sugars. Well, I drink my 100% pure orange juice. Mr. Frank, Brother Fred says he doesn't believe that it's 100% pure, but I believe it's 100% pure orange juice. I don't consume sugar. I will take once in a while. We are not encouraged to, a lot of the processed foods does. Processed foods have elements in there, things in there that can contribute to cancer, all types of cancers, not breast alone. So I had to stop. I was a person who loved luncheon meat and sausages and corned beef. I stopped all that. I don't know when last I had those things. I consume more fish. I stopped we are discouraged from eating a lot of red meat, because red meat seems to have some kind of thing in there that contributes to cancer. And by the way, when we speak of red meat, goat meat, beef. Why are you laughing, sister? I used to think pig. We had a joke on the bus going up. When we went forward drive today, we had a joke. That's why she's laughing. I used to think pig meat was white meat, but pig meat is red meat too. All kinds of red meat. Lamb, goat, pork. You can eat them, but try in little small amounts. So I have stopped a lot of those things from my diet. And the sugar part, they're still doing studies But my oncologist in the States, that was one thing she told me. Try your best to consume very little sugar. So I've almost cut off mostly all sugar. And she also told me, try not to put on weight. Try to stay slim, because obesity, we saw, can... certain cheese. Now, that's an area I'm working on, because I love cheese a lot. I'm still working on that part. I love cheese. But cheese, certain cheese can predispose to cancer. So there are a lot of things here. But they will tell you the best thing is plant-based. Avoid soy. Avoid soy things, if you can avoid it. So I try my best not to take things with soy in there as well. So there are a lot of things they tell you. Now, another thing that, and I believe, and I'm talking about myself, this leaf, what's its name? Soursop leaf has proven, they're still doing studies, has shown to reduce risk of many cancers, but particularly breast cancer. And when I was diagnosed with breast cancer, there was a lady just before she died. She said to me, I was preparing to have chemotherapy, and she says, Beverly, just drink soursop leaf. I don't believe she's from Anguilla. She was from Anguilla. I don't believe in this chemo. This thing's more killing you. She died 2 days later after telling me. So she died she called me from Anguilla, and she was coughing a lot. And I said to her, you're coughing? She says, yes, my dear, I'm coughing a lot. I said, go do a COVID test. She went, she did a COVID. I called her back the next day. Yes, my dear, I'm diagnosed with COVID. And 2 days after that, she died. But that thing she told me stayed in my mind about the soursop. The amazing thing, I can give my testimony about this breast cancer, but I'm not going to talk much about it. One thing I know, I shared with my church. Many of my friends, a lot of my members from my church started to bring soursop leaves, and I would just drink, and I'm still drinking up to today. And one day my niece came home, and she went in the yard doing some work for me, and she says, Auntie Beverly, you know you have a soursop leaf tree growing in your yard? I have a soursop leaf tree in my yard? I don't know what's a soursop leaf tree then. What are you taking me for? I said, I don't have any soursop leaf tree in my yard. She said, Auntie Beverly, you have a leaf tree, soursop leaf tree growing in your yard. And lo and behold, I did have a soursop tree in my yard. So I went to my husband when I said to him, how did a soursop tree end up? He says, 2 years ago, before I been diagnosed, he says, something just told him to plant a soursop tree. And he just decided, and I have a tree growing, it's even bearing soursop. So right there, I know it's the Lord that went before me and prepared that soursop. And I believe the soursop leaf, I drink that so often, I believe that has contributed to the fact that the last lump they saw in this breast, and they wanted to biopsy it. When I came back, it just shrink. I believe it's a soursop leaf. I just believe that. So I drink and start drinking, consuming, drink it. I drink it like a thing every morning. While I'm here, I missed it for 4 days. I'm missing it. As I go home, I'm going to start. Any other question? Yes?
I am just thinking, some people are diagnosed with diabetic hypertensive. So I'm thinking, can someone have breast cancer and cervical cancer at the same time? Yes. I'm just thinking.
Yes. You can. Cancer is cancer, yeah? Yes, you can have cervical cancer and breast cancer at the same time. Yes. Also, you can have your both breasts being diagnosed with breast cancer at the same time too. Yes, we have had that happen.
Beverly, I'm just wondering, what is the real difference between a mammogram and an ultrasound? I know the difference in the way it's done, but what is the technical difference, and which one is more effective in detecting breast cancer?
Okay, I'll tell you what I think. The mammogram is, they put you and they squeeze your breast and they take pictures, right? And the mammogram will show either dense breast. When they say dense, you see all these tissues in the breast, and sometimes it cannot really detect whether there is any lump in there. So the mammogram will detect lumps, and it will tell you there is particular a lump in there. But for some reason, ultrasound, a lot of times, when they are not sure what the mammogram, whether the mammogram is really showing there, they're confused. Then they ask you to do an ultrasound, and the ultrasound, for some reason, tend to show it better. So for me, when they did the mammogram, they put suspicious lump. And then they asked me to do an ultrasound. And the ultrasound gave more suspicion. And then they told me then I have to do a biopsy. And I know the member from my church, well, long ago, the radiologist who died of breast cancer, she never did mammograms. She just would say, don't bother do mammogram, just do your ultrasound. There seemed to be a slight, one seemed to be better than the other, and it looks like ultrasound tends to give a more accurate reading. On the ultrasound, by the way, they look at the colors. They look at colors, and if the lump looks black, if it shows a dark color, just dark, very likely it's a cyst. If it shows white, then they want to investigate it. They'll ask you to biopsy it because it may be a cancerous. Sometimes it's not, but it may be a cancerous lump. Yes?
Yeah, I have two questions, Sister Beverly. One, you spoke about the orange peel color.
Orange colored looking. That's always the late stage.
If you were dark, would it show lighter, or the skin shows like the orange skin?
Yes, it actually, the young lady who died from my church recently, her skin, her breast had the orange looking thing. When I looked at it, there was the classical picture of, you ever see grapefruit skin, right?
Yes.
The little dot, it was just looking like that, and she's dark. So it looks like multiple little pimples. It just looks like a orange looking, and sometimes it appears a little orangish color too.
Okay, I was just wondering because there are people who are very dark. And two, I'm not sure if it's a myth or I have heard that contraceptives links to breast cancer with the percentage of estrogen in it, so I'm not sure. Maybe.
I didn't get that one, but yes, I've heard of, I predisposes you breast cancer, yes.
Yeah, okay.
I've heard so myself. Yeah.
Okay.
As I said, there are a lot of risk factors that I didn't have, it would take me a lot because there are so many things and they're still studying a lot of those things, so,
So, I used to suffer a lot with the endometriosis. And the doctor used to give me, when I couldn't take the pain again, they used to put me on contraceptive, let's say for about 3, 4, 5 months.
That hormonal thing to
and when I stop it, the breast was very, very sore. And then it used to milk in it, water discharge.
Well, that was a side effect of the drug. That was just a side effect of the drug because remember, the drug is working on your hormonal level and it may be affecting other hormones like oxytocin and all the other hormones too. What I want to encourage you, when you see doctor puts you on a medication, you can always Google it. Go to the best friend in the world, www, and Google, and it may give you all the different side effects to look out for. That doesn't mean you will experience it, but if you do it, if you see, you say, oh, it did say I would get that, yeah? But that doesn't mean your breast was cancerous. It was just a side effect of the drug.
Okay, thank you.
You're welcome. One more question, and that's the end. I wanted to tell you, before you ask the question, the son I was telling you about, he was born on my birthday. Okay, go ahead.
How often after menopause should a pap smear be carried out?
All right, that's a very good question. A lot of women will say after menopause there's no need to do, but you still have to do your pap smear. Maybe you may do it every year or every 2 years, depending on what the doctor says. Okay? You may have to do it every 2 years at least, or every year, because when you do it, if it's okay, they may recommend they come back 2 years' time or in 1 year's time. Because I know in the UK, for instance, there's this friend of mine, she did a mammogram, and she told me the doctors tell them in the UK is every 3 years they have to do it. And she's my age group, and she has to do hers every 3 years. But yes, you may do it. They may ask you to do it every year, but you should do it, because even if you're menopausal, remember you may be still sexually active, right? You're so happy you're not going to make children again. Now you're sexually active, so you must do your pap smear. Yes. I think that was the last question. Thank you so much, and I hope the presentation was good for you. Yeah.
Sister Beverly, thank you so much. The presentation was very informative. We thank you for the questions that you allowed us to pose to you, and you answered so comfortably and so well informed. We also thank you for sharing your own testimony with us, and that adds a lot more to the presentation, because we see you standing here looking as healthy and as beautiful as you possibly. But yes, and you have been visited by this awful illness. So we thank you immensely for this presentation, and we look forward to using you again. I want to thank all of you for attending this session. And of course, as always, if you don't apply what you have learned, your time here is wasted. So starting from this evening, you should be able to go in. Alfred is... Oh, okay, all right. Okay, it seems that you had some persons viewing you online, and we want to thank you all for attending, yes. And we hope that this message is useful for you as well. So, go home and start practicing. And for those of us who's only going to have to do it once a month, let's do our once a month again. Thank you again. Sister Natalie, at this time, would you come and close us in a word of